Good morning and happy Monday. Hope everybody's week is off to a great start. Want to take just a few minutes, probably more than a few minutes, to go through the details of the COVID protection bill that we passed late Friday night in the wee hours of Saturday morning. Ended up passing Saturday morning about 2:30 Eastern time. There's way too much. I could make a 2-hour long video and no one would ever watch it. So I'm just going to try to take like 10 minutes, zip through this, and hit some of the high points and answer any questions, answer some of the questions that I've received in emails over the weekend. I've got hundreds of emails over the weekend, and so I'm going to work to do that. But if you still have questions, kind of want to talk through it, you can just reach out to me at 615-741-2264. And remember, there's a staff of one, and then there's one of me. That's it. And so there's no way for me, if we get hundreds and hundreds of calls, there's no way for me to reply to everybody. So I always take constituents who actually vote for me in my district. They get first priority, then the rest of the county, and then the rest of the state. So when I get this many calls, just know it has to be in that order. But hopefully this will answer some of the questions. And then again, if you see me or want to send me an email, whatever's easiest, we'll work to provide clarification. But I've got just a quick list here, the summary of everything that we did, so I don't miss anything, and then go through this in detail, and then answer any questions you have. So we passed the most extensive COVID protection bill in the country early Saturday morning, without a doubt, period. I've talked to a national media guy this weekend, and he said the closest thing to us is Montana, and they didn't do half of what we did. Is it perfect? No, it's not perfect. Did we get everything we wanted? No, we didn't. But I do feel like we got roughly 75% of everything that we started out to get. We got that in this bill. Tennesseans are better off with this bill passing than they were before we passed this bill. Now, the governor still has to sign it, but Tennesseans are better off. We put significant protections in here, significant protections. And again, is it perfect? Are there things that could have been done better? Absolutely. Were there some exemptions made on the federal piece? Yes, there were, and they had to be, and I'll explain those in just a few minutes. But Tennesseans are better off today, once this bill is signed by the governor, Tennesseans are better off than they were before this bill, period, end of story. And there's a ton of rumors, there's all kinds of opinions being offered by people who think they're experts on this legislation that were never in the room, never involved with attorneys, never involved in the conversation, the drafting, involved in the input of what went into this over a 3-day period, but they weren't involved in the weeks leading up to this as we drafted this legislation. So that's extremely important to remember. If you got a question, go to the source versus listening to people who have opinions that have not been involved or in part of the leadership or engaged in walking through the passing of this bill. That's extremely important. So let's jump right into it. I'm going to go quick. I'm already 3 minutes in. First thing, we banned vaccine passports. So banning a vaccine mandate is going to send us right to court. We took this route where we banned vaccine passports, meaning you can't be required to show proof of vaccination of the COVID vaccine. Now, there are some exemptions that had to be made there, and I'm going to explain those. But we banned vaccine passports. It covers 80% of the people. And if that language is on page 8 of the bill. If you jump to page 1, the definitions are extremely important. And it says that adverse action can't be taken for someone if they don't show proof of vaccination. That is what protects your employment. You can't be fired. You can't have your salary reduced. You can't have benefits pulled, promotions, rights, conditions, locations, compensation. It's all in there. Adverse action can't be taken by a private employer over you if you choose not to take the COVID vaccine. We also provided that protection for children in schools. You can't be required to show proof of vaccination for your child in terms of the COVID, and that's all related to COVID-19. There were some questions about entertainment venues. That's something we can go into more detail, but entertainment venues cannot require you show proof of vaccination. You can voluntarily, the word voluntary is in there, you can voluntarily show that if they still required a negative COVID-19 test, or you can also show an antibody test that show you already have immunity. But if you don't have one of those and you've already had the vaccine, you can voluntarily show that in place of a negative COVID-19 test or or a immunity test that shows you have immunity to the virus. It's extremely important. It's voluntary. They still can't require that. The entertainment that comes to Bridgestone, the Ryman, Tennessee Theater, they set the terms and conditions when they come, and many of them are requiring masks and all these other things that are completely unnecessary. Some of them, as Dr. Terry, who was on our conference committee, who's chairman of health, said are not medically sound because you can still have the COVID virus and transmit the COVID virus if you've had the vaccine. So a negative COVID test or an immunity test are actually the two best options to provide. And that's according to a doctor. That's not my opinion. So that I wanted to provide some clarity related to the entertainment venues. Next, we have prohibited masks in schools, and that's obviously a big deal for those of us in our county. The questions are coming in. How does that affect Knox County? The AG has to review this language. We got to get the governor to sign it. Then we can take necessary steps to challenge that federal judge's rule related to Knox County. But you have prohibited masks in schools. There are some exceptions for that under severe conditions, but that is an extremely high bar. It's a 14-day rolling average of 1,000 cases for every 100,000 people. That bar has not been reached, and so that is an extremely high bar we set. We've got to be under a state of emergency. So if it were to get really, really, really bad, it would provide the opportunity for an exemption. But again, that point has not been reached in our county. And so again, it would have to be an extremely high bar, but it can never be countywide. It is school by school where the principal petitions the LEA. We also made some ADA, the principal, I think I said LEA, the principal petitions the LEA for that particular school. Then we also made ADA accommodations, which is that federal judge that's ruling Knox County as a dictator right now, over 60,000 students. We provided some ADA accommodations in here where a parent can request reasonable accommodations directly to the principal, and that would apply to that particular student, and the principal would then make those accommodations. So that's extremely important. We also banned any governmental entity from requiring masks, and so that's a big deal. City of Knoxville, any governmental entity can't require masks. That also applies to the definition of schools, I should have said this, also applies to universities, so like the University of Tennessee. And so that's, again, that's extremely important. We have addressed the mature minor doctrine, which means that if you're under 18, you have to have your parents' permission before you get the COVID vaccine. As state law stood now, that was not the case. We've addressed that. We've addressed the right to prescribe. So we're protecting doctors and patients in their relationship and allowing doctors to not have fear of their medical license being pulled or threatened by a board because they will not, because of the way they're treating their patient. So specifically with ivermectin or hydroxychloroquine, they prescribe that. They're protected in doing that and doing what they feel like is best for their patient without their license being threatened. We also included a right not to die alone. This has been a tragic part of COVID where facilities have not allowed loved ones to be with their family members in their last days, and that has been extremely unfortunate. And so we address that here, where your loved ones won't die alone. You'll be able to be with them if, God forbid, they are going to pass away from COVID. Probably one of the most important aspects of this is the anti-commandeering language we added. It says no state resources can be used in the implementation of any federal law, rule, or regulation related to COVID-19 countermeasures. And so that is extremely important. The federal government can issue all these rules, but we have said no state resources, personnel, property can be used in the implementation of that. So if they want to do it, they got to come down here and do it themselves. That's important. We also addressed the distribution of monoclonal antibodies, meaning that the federal government inserted the states in that process, just as the federal government does. They just created a cumbersome process. A process that was working well became cumbersome. They inserted the states in the middle. Some rationing was involved, guidance was sent out, and it created confusion. We have now said that the doctor is the one who decides who needs monoclonal antibodies the most, and so we've left that up to them. We've also provided unemployment protection. If you are many companies are putting people in purgatory, basically saying that if you're not going to get the vaccine, then you're just going to be on unpaid leave, which would then prohibit someone from getting unemployment if they left to go get another job. We've corrected that in this. So if you are forced to leave or leave because of the COVID mandates, COVID vaccine mandates, then you're eligible for unemployment. And then also we provided a cause of action. If someone's, if they can't require you to show proof of vaccination, but if they say they want you to get vaccinated and you decide to do it anyway, even though you don't have to show proof, and you have an adverse reaction, you have a cause of action against that employer who has made you do that. So that is a huge deal. Now, let me jump back quickly to two things in particular, two extremely important things. And I've gotten a ton of questions on this, and this is extremely important. We have protected our healthcare workers. There was some confusion because of some language on page 5 related to Medicare and Medicaid providers. It's right here. So it's this language here is what you need to focus on page 5. We have protected healthcare workers. Let me repeat, we have protected healthcare workers. In this bill, healthcare workers, when this is signed, they are protected from being required to show proof of vaccination. Now, we had to provide an exemption because of Medicare and Medicaid dollars. Medicare, no facility can operate, no hospital, they cannot operate without Medicare or Medicaid dollars. They would go under. So if Medicaid or Medicare, CMS, who runs Medicaid and Medicare, if they were to issue a rule that requires vaccination, then those providers would be exempt. It would, if they do that, it would literally cripple the healthcare system anyway. But if we didn't provide that exemption, the healthcare system would be non-existent. No one could actually move forward in healthcare because of the resources from Medicare and Medicaid, and that is significant. So you are protected healthcare workers on the front end. The governor signs this. I believe it's St. Thomas. I believe it's St. Thomas Ascension in Middle Tennessee. I think they have a November 10th date coming up that you have to require proof of vaccination. This will be in law by then, assuming the governor signs it, and you'll be protected. Again, there's only an exemption on the back end if CMS takes action as the federal government versus being a unreliable partner continues to be adversarial, and the Biden administration continues to weaponize the market against us. If they take those actions, then we have to exempt those facilities because they wouldn't be able to operate, unfortunately, without Medicare or Medicaid dollars. So you are protected on the front end. Our healthcare workers have been heroes. They worked through 2020 without a vaccine. Many of them were exposed. Many of them have had COVID, but yet we're saying that you have to be vaccinated. Healthcare workers have to be vaccinated in order to continue to provide healthcare, even though the CDC director said on August 5th that the COVID vaccine does not stop the transmission of the virus. So again, this is not, as Dr. Terry, who was instrumental in this, Dr. Brian Terry, who's our chairman of health, served with him in the House. He was instrumental in making sure the healthcare workers protected. I give him full credit. He was awesome in that conference meeting. He's a doctor providing sound medical opinions, and he fought for this, and we were able to support him in that, and we went with our language in the House, and we protected workers on the front end, so that's extremely important. Lastly, and I'm almost at the 15-minute mark, so I'm going to go quick. Lastly, there is some heartburn over exemptions related to federal contractors. It is important to, if I can find it, hopefully I'm not going past it, there it is. Language related to federal contractors. We have put a process for exemption related for those who are federally awarded contracts, subcontracts, or post-secondary grants. They have to be awarded. A federal contractor signs an agreement with the federal government in a contract for services. They respond to some sort of request for quote, request for services. They fulfill those requirements, then they sign a contract for services with the federal government. They sign a contract, almost like an employment contract, but it's a contract or agreement between the federal government and that particular private entity. They willingly sign that contract, and there's terms to that. The new terms for all those contracts is their employees must be vaccinated. There's actually even a spot that says that you check that, and then that has to be uploaded into the system. I don't like it. It's terrible. Again, the federal government has become adversarial in our relationship with the states and the federal government, but we had to exempt those entities, and we did. We had to exempt those entities because they would not be able to fulfill their federal contracts. But it only applies to those who are under the federal contract. For example, University of Tennessee gets $750 million for 3,400 positions. That's only a small portion of their workforce under that federal contract, so it only applies to them. But like for UT, Memphis has 1,000 with a 260 million. ETSU has something like 400 or 500 under a federal contract. If they can't fulfill that contract, then that money just simply goes to a blue state, to University of Colorado or University of North Carolina, whatever it may be, and then all 3,400 people under that contract lose their job. And so there's some questions. Why didn't we fight? Why didn't we push back? There's a letter from the governor of Montana saying that we're going to fight. And that would be a question for our governor in terms of fighting that. But we had to provide an exemption path for them to ensure that they continue to fulfill those contracts. And again, it's a federal contractor issue. It's not about anybody that gets federal money. It's you've signed. The federal contractor has signed an agreement as a private business to the terms and conditions of a contract. They have to abide by those contracts, and they have to be exempt from this because they've signed a federal contract. And so there is a process we put in place. You got to go through the comptroller. He has to review that. He has to provide approval for that exemption. And we are going to stay engaged and stay involved in that process. But just know the difference and why we had to do what we did with a federal contractor. It was important because, again, they employ thousands and thousands of people. And I know, I've talked to so many of you, those who don't want to take the vaccine that are under that. It's the federal government, their requirements, the Biden administration weaponizing the free market against us, and those who work for federal contractors, they've signed those federal contracts under those terms and conditions, and they have to abide by those. And so we provided that exemption. And so finally, there was also some concern and questions about the termination date of this, which is July 1st of 2023. We put termination dates on many pieces of legislation that are revisited over and over again. It just forces us to take additional action, to review, and that's exactly what we're going to do with this. We already are in discussions already. I had those discussions yesterday with the speaker about plans and what we'll need to do in terms of the extension of this when we go back in January. But again, we have 2 more general assemblies before we get to that. All these protections are in place, and we've got this covered for the next 2 years. If we're still talking about this to this extent, July 1st of 2023, our problems as a nation are much bigger than what we're facing right here. Our republic is being battered around a little bit. We got to stand up and do what we can to defend our liberty and freedom. We've taken a significant step with that, with this piece of legislation. Is it perfect? No, it's not perfect. But Tennesseans are better off with this in-law signed than we were before we went in. Do I wish we could have just done everything possible in this legislation plus more? Absolutely. But that is not the reality of the political environment. It's just simply not. And so I'll be glad to answer any questions you have. It's almost 10 o'clock. I'm going to jump on with Bob Yarborough at 11, and so we'll kind of walk through there. And but if you got questions or want more clarity, 615-741-2264. Call me. I'll do my best to call you back as soon as I can. But again, you got to be patient because I got one staff and there's one of me, and there's a whole bunch of you. And so I want to do all I can to answer your questions. But read the legislation for yourself. It can be hard to read because it's all drafted by attorneys. But I can tell you, as a person that was in the room, we fought on your behalf. It's not perfect, but we are better off as Tennesseans, much better off than we were before this legislation passed. We got to get it signed. Again, we banned vaccine passports. We prohibited masks in schools. We prohibited any governmental entity from requiring masks. We addressed right to prescribe. We preserved the distribution of monoclonal antibodies. We have an anti-commandeering provision that keeps state resources from being used to enforce these things coming from the federal government related to COVID-19 countermeasures. We protected your ability to be able to be with a loved one, unfortunately, if they die. We provided a cause of action. These are significant, significant steps forward. No state in the nation has done this. None. And so, again, I would just ask that you look at the positive aspects of this without focusing on the couple of pieces that we didn't get. But again, this is a big win for our state. And so I hope this provides some clarity. If you need me, call me or email me, and we will just get back to you just as soon as we can. Have a great Monday. Thanks.